Hi, and welcome to the second episode of How Are You Really? Finding the Sparkle, Living Beautifully with Anxiety and OCD. I am your host, Dr. Faryal Mallick. I'm a child, adolescent, and adult forensic psychiatrist, and I am very pleased to introduce my good friend and an award-winning licensed psychotherapist and professional speaker, Marquita Myrick. Hi, Marquita.
Hi, Dr. Mallick. Thank you so much for having me on your podcast. I'm
You're
excited about
right.
this.
So just a little bit about Marquita. She's a speaker and psychotherapist. She partners with individuals to help them reconnect their mind and body. She creates safe spaces for healing. She has assisted hundreds of individuals in improving their mental health using integrative psychotherapy practices. She specializes in developing skills to overcome anxiety, depression, relationship conflicts, and trauma. With her ability to motivate audiences, Marquita is a powerful voice on mental health, inspiring others to overcome challenges and build resilience.
Oh, is that me? Is
That's
that who I
you.
do?
I'm so excited. I'm so excited to hear more and talk about everything that you have to, kind of educate us on because I know that you are an amazing speaker. And
Thank you.
so I'm thankful and grateful that you're here today.
Yes, I'm grateful to be here too. And I appreciate your compliment. That means so much to me.
Of course, it's my pleasure. All right, so I know that we were going to talk a little bit about anxiety and OCD. Can we just start with the difference between the two? Because, people say, "Oh, I'm so OCD." I mean, such a commonly used word. So I kind of want to just go start with just simply that. Like, what is
Yeah.
anxiety? What is actually OCD? Because I'm sure that not all of us are OCD.
Right, right. And that was when I decided to start talking about my OCD journey at the beginning of last year. That was one of the things I wanted to do was say that everyone talks about, I have OCD, I'm OCD in this area. And in the day and age of the TikTok therapists, right, who are or are not therapists, everybody just takes on that label. And it's not true because you and I both know that there are specific things that fall underneath those diagnoses. And so yeah, with anxiety, it's excessive worry or fear about something. And people typically are worried about things that have not happened yet. And that can be characterized by racing thoughts. Some people have dizziness. I've heard of people having headaches with anxiety. They definitely pull away from people. And there's this, we call it experiential avoidance in the therapy world. And I did a lot of that avoidance because you don't want to go around people that might make you anxious, or you don't want to go into situations where it might provoke anxiety. So I had a racing heart rate all the time. I was just elevated, just on edge. So a lot of people describe it as being easily agitated or on edge. And we certainly see a lot of irritability in kids with anxiety, going through that right now with my kiddos. So that's anxiety. And then OCD can have some components of anxiety. And actually, for me, when I was first diagnosed at age 19 with generalized anxiety disorder and obsessive compulsive disorder, first, what was caught was the anxiety and not the OCD, because oftentimes those symptoms are so extreme. Those intrusive thoughts, the behaviors, they seem odd. And so in your head, as a person with OCD, you don't want to tell anybody about it. And so it took me going through several therapists in college before I finally started hinting at some of the things I was doing around OCD. So OCD is characterized by obsessions and compulsions. And when people have these obsessions, it could be over a variety of things. But the bigger issue with OCD is that the compulsion often helps to ease the obsession. And so for me, I had OCD around safety, and I also had OCD around cleanliness. And so I would have obsessive thoughts about my safety, my family's safety. And so just to use the example of my family, I had to do something to stop that thought. So the compulsion was I needed to check in with my family a lot to the point where I got told off by a family member. I'm not going to out her on this podcast, but there was a come to Jesus moment with someone in my family who said, "This is a bit much. Like, you're calling my friends to find out where I'm at. You're calling men to find out where I'm at." Like, so. But yeah, OCD, it really is characterized by those obsessions and compulsions, and people can spend up to 1 hour a day. That's really that criteria for diagnosis. If you're spending up to 1 hour a day on these symptoms, I believe at the time I was spending closer to 8 hours So you can imagine when we looked at, I was like, I'm smart. I don't understand what's going on, but I was failing out of college, right? I was spending, when I really looked at it and my therapist asked me, I was like, she's like, how often do you spend with these symptoms? Probably about 8 hours out of my entire day from the moment I wake up. The only thing that stops it is sleep and eventually medication. So hopefully that helps the audience just understand the difference. Anxiety can be characteristic of one of the symptoms that OCD kind of evokes out of a person, but they're very different.
Yeah, I'm gonna just kind of follow up on that. A lot of
Yeah,
the
yeah.
times people are so anxious about like taking medication. You're a psychotherapist, right? I'm an MD. I'm
Yes.
labeled, oh, she throws medicine at people. But like you
Yep.
said, medication. So like, can you tell me like how like
Yes.
medication helped you, like why you decided to take medication? Did you have fears related to taking
Yeah.
medication?
Yeah, that's a great question. At the time, the fear of the side effects was not as large as the fear of continuing to live the way I was living. And so I think that's important for people to hear because oftentimes people wait until it gets way too bad to go see a psychotherapist, to go see a psychiatrist, to pursue a medication evaluation. And for me, I remember having the symptoms of OCD as early as age 7. So if you think about how long that took me, I started going to therapy at 19, my sophomore year of college, and then it took another 1 to 2 years for me to cycle through therapists and finally open up about it and get a diagnosis. So it was too long. But by that time, if you think about it, I'm failing out of college. I have very high stressors. I'm not dating, so I'm lonely. I'm lonely. I was also diagnosed with
Mhm.
major depressive disorder at the time too. So all of those things were so high that when my doctor said, "I think you could benefit from some medication," I felt helpless at that point. Sure. At that point, it was like, whatever. You could tell me to go exercise around the University of Colorado at Boulder, which is where I was at the time, 7 times a day, and that would help stop the thoughts. I probably would have tried it. So medication really helped change my life because what it did was it eased the symptoms and brought them down a bit so that I could have more mental freedom. I could have more space in my brain to say, oh, maybe I can practice those skills my therapist has been teaching me now. But to be honest, Dr. Mallick, without the medication, I do not think I could have gotten there. I think I'd still be having debilitating symptoms.
Yeah.
Yeah,
All right, it's great that you recognize it. That's like the half the battle, right? Like, and I
it
always tell
is.
people that like surely like anxiety, like medication is not the answer, but if you can't even come down to where you can learn the skills, you
Yes.
need to at least bring it down to where you can learn the skills and apply them. So yeah, thank you for that.
Yeah.
That
Yeah.
that's really helpful.
Yeah. Can I add something else? I think, and I don't know how much you see this in your practice, but when people think of getting on medication, they don't see an out. They
Mhm.
think, oh, I just got to get on the medication and then I'm on it for the rest of my life. So in my mind, this is a means to an end. I don't
Mhm.
really want to do this because there are side effects. However, what's on the other side of that door if I take it and it really helps me? Just
Mhm.
what if in 3 to 4 weeks something shifts, which
Mhm.
it did, obviously, because I'm here today, right? So I think it's important for people to hear that too. You don't have to be on it for the rest of your life. There are skills you can learn to address this on a daily basis so you don't feel like it's holding you hostage. So yeah.
Absolutely, yes. All right, so tell me about like, what you mean by finding the sparkle.
Yeah, finding the sparkle. I know it's a catchy title, right? Finding the sparkle for me involved medication. So it's
Yeah.
a great follow-up to the talk
Oh,
about medication because I started to see parts of my personality that had been hidden for so long
yeah.
show up after I'm on the medication. And then I had enough mental space to actually practice the skills. And then my mom even said over the phone at the time, you sound different. And I'm like, what do you mean? She's like, you just sound the way you did before you left. You're starting to sound like that again. And so, and just for the audience, I was on medication for depression and I was also on medication for OCD. Initially, I was just on medication for depression and anxiety because remember the OCD diagnosis came later. So
Later,
then that had to be tackled, right? And you can speak better to like what medication goes with what, but so because I can't remember that part. I did keep all my records though
yeah.
from the hospital because I knew one day I would talk about it openly and I would want to be able to reference the things that I've tried. But yeah, finding the sparkle for me started with therapy combined with medication, combined with that realization that that old me was coming back and then recognizing, wait a minute, parts of my old personality are starting to resurface. And now I get to see who I want to be moving forward. So now that I know what I have, and I'm not going to live and be labeled by this diagnosis. However, I know what's been bothering me all my life. So who do I want to be now? Where's the fun in this? Because if it's just you got to go to therapy, you got to take medication. There's no fun in that. I started to learn that there were parts of my OCD I could actually laugh at, and I still laugh at to this day. So yeah, that's what I mean by finding the sparkle. Really owning this is a diagnosis that I have, and it doesn't have to define me, and I can craft a life where this personality gets to evolve over time.
Yeah, absolutely. That's amazing. And then, the follow-up to that, right? The sparkle and the kind of life being beautiful can mean th different things to different people, right? So what do you think a beautiful life looks like, especially
Yeah.
when people are navigating anxiety and OCD?
Yeah. To me, a beautiful life can look differently for everyone. A beautiful life for me started with recognizing that OCD is a superpower for me. So, if anyone's listening, a lot of people nowadays are talking about ADHD being their superpower. And that's how I reframe it for clients who go to their medication prescriber, they get that diagnosis. And I've certainly done some diagnosing of ADHD historically. And people can feel like, whoa, this has really impacted my executive functioning is off. And so I'm struggling to survive. And I think, well, there's some strengths in there. So what are they? Like, let's look at those strengths and let's pair those with the things you value. So for me, living a beautiful life with anxiety and OCD is really just, again, owning that it's a label, but I don't have to see it as that's all I am, right? And it's beautiful to me that I get to see it as a superpower because I mentioned earlier it was safety and cleanliness for me, and I'm still very clean to this day. I'm still going to check those doors at night, just not 8 times, right?
I got you.
Not 8 times anymore or more than 8. Let me be honest, right? So, but it's beautiful to me that I still get to be a mother and I still get to protect my family and I
Mhm.
still get to check the door and I still get to have a clean home. And
Yeah.
now I own how often I do it. And now it's also beautiful to me that I get to talk about it openly and not hide the stigma of it, even as a therapist, because that was what I struggled with, not with anxiety and depression, but struggling with talking openly about having OCD. Um, to me, it's beautiful that they talk about OCD being a chronic condition. And part of the beauty in it for me is saying it can be chronic all at once. You're not going to be chronic in my life, not in the way that the DSM-5 listed as chronic, not in those symptoms. I have some control. So there's beauty in finding what areas of your life you have control in. There's
Mhm.
beauty in identifying the strengths within whatever that diagnosis is. And there's beauty in reframing it to this is my superpower. That's beautiful to me because now
Yeah.
I feel like I have OCD wings now.
That's
Instead of it's something I want to fight. I'm sick
Yeah,
of you.
exactly. The funny thing is, it reminded me that one time when you and I went out for lunch and you were like, we were gonna drive somewhere else somewhere, and you were like, my car is dirty. And I was like, what's dirty? I was like, I can't imagine it's dirtier than my car. I just can't. And I think that maybe there was like a piece of paper laying down
Yeah,
somewhere.
yeah,
And
not
so, I mean,
much.
right, absolutely. So, I mean, it can be a great trait, right? Like, I will
It
leave
can be.
papers or books in my car all the time, but like having that, maybe recognizing if you do have OCD, you don't have to like make it sparkle every time, but you're organized. You can,
Right,
it's a superpower to have it, rather than me with my, okay, when I need a certain book, then I'm looking at 10 different places. Where I put that book?
right. Where is that book?
Where's
Right.
that book? Yours are just like, exactly where they
I know
are.
where everything's at. And I
Yep.
love that you brought that up because I think it's such a good example of me finding the beauty in it and me having control over it. Because historically, I remember this one time I had a friend come over to my apartment and she came in, I had cooked for us, and she did not want to sit down on the sofa. And I was sitting on the sofa eating, and I said, "Word, you want to sit at the table? You want me to come to the table? You can eat on the sofa." And
Yeah.
she said, "No, girl, your apartment is too clean. I'm afraid to waste any, like if I waste one drop of this food on this sofa, I don't know what will happen." And I don't even know that we had talked openly about my OCD at that point, but that was one of my wake up calls because I'm like, wait a minute. Family and friends are coming over and they don't even feel comfortable sitting on the sofa. People would literally sit on the floor
Hmm.
and eat a snack. And so it's helpful for me to hear that I've worked my system so well that I call it out. Like OCD says, oh, if she sees your car, what is she going to think? You have not excessively cleaned it this week. You haven't had time because of your busy schedule. So what
I
is she going to think? But I called it out. Hey, just so you know, my car is not
I know.
And then I gave you the opportunity to say, it's fine, girl. It's probably fine. And it
Yeah.
was, right? So, but
Was
that's
there was
just,
nothing. I was like, what is she talking about? And I was like, I never want her to see the inside of my car. That's a waste of my head.
and that's the other challenge because then people are like, I feel like I need to clean up for you. And I'm like, no, no, no. People say, oh, I can't have you over. Trust me, my OCD does not judge your home. It judges mine. It
Yeah.
judges my car. It's very obsessive about Marquita,
Yeah,
okay?
that's incredible. Okay, so let's see. Talk to me about what tools that your therapist taught you and what are you teaching your OCD patients, like how to cope with this because this is a lot. It can take a lot of time,
Hmm.
right? You were
It
busy, you
can.
weren't able to clean your car the way your OCD would want you to. So how would you manage like doing that, right?
Yeah.
What skills were you taught to like not have to be like, okay, I'm not gonna do whatever else is important because I gotta clean my
Yeah, yeah. Such a good question. We focused heavily on cognitive behavioral therapy. And to this day, I love CBT. I've been medication free from OCD, anxiety, and depression medication for over a decade now. I'm
amazing.
very proud of that
Mhm.
because I practice the skills on a daily basis. And what I tell people is that this is all going to sound overwhelming at first. I'm going to share you a high level overview of how I plan to treat this OCD, this anxiety, right? And but I don't want you to get overwhelmed because we're going to break it down. And so, even for my therapist, we went straight to CBT. And
Yeah.
we did. We went straight to CBT. I started getting medication eventually, but I did have a period of just doing therapy, practicing CBT, and feeling like I was failing at it
Hmm.
before I got to the medication. Because again, if you're spending up to 8 hours a day thinking, even reading my books for school in undergrad, I would read a paragraph like 4 times, and then I would stop and say, did you even absorb anything? And I didn't because I was only reading it 4 times because I was obsessed with numbers in fours or eights.
Hmm.
So it was like even going to the library and studying with friends, or even going to, I think, IHOP at the time in Boulder,
Hmm.
Colorado. We're sitting there trying to study, and everyone else seems focused, and I look focused, and I'm not. Right. So I ran this race that I kept tiring out in before I got medication, which is I think
Yeah.
another good thing for people to hear. Like, let's shorten the healing gap here with
Yeah.
medication. So, but yeah, she really taught me CBT skills. And eventually when I got on medication, that helped. And I didn't learn to see OCD as a superpower until recent years. So that was a newer revelation for me. But she really helped me understand my values too. So with CBT, and it was a lot of values-based work and a lot of mindfulness based work. Like, we've got to challenge these thoughts with some CBT. And I
Hmm.
want you to be mindful about how you're going about life. And at the end of the day, your values really matter. And
Hmm.
so that's the part I connect now. Like, oh, wait a minute. My values really helped me understand that although these symptoms are underneath this diagnosis, I actually still value being a clean person.
Yeah.
I actually still value being safe and being aware. My mother in law always says, be vigilant when you go out. Be vigilant, especially when you're out with the kids. And I say, oh, you don't have to worry. I have OCD. I'm extra vigilant. You never have to worry about that, right? But I value that. I value that safety because my childhood home was broken into at one point. There may be this diagnosis. However, I had these life experiences prior to that diagnosis that all added up to collectively impact that diagnosis. And so the values work was so important for me too.
Yeah. Okay, so do you have pets?
I don't.
Yeah. Is that part of the OCD? Just
It's
curious.
not. It's not actually.
Okay.
So there is a OCD component with animals. I will be honest. We
I
don't
just
have
heard my
pets.
cat meow, and that's why I was like, huh, I wonder if Marquita has pets.
Honey, she has pets. So I wanted at our first year of marriage, I wanted a very small dog. I wanted a teacup poodle. So and
They're adorable.
and yeah, I would definitely need a dog that's like hypoallergenic. I don't mind cats, but they wouldn't be my preferred pet. But now, even when we're walking in our neighborhood, our community, there's one neighbor, her dog, she stopped doing this because I think she could pick up on it, but she would loosen the leash because her dog just, I don't know what it is about my energy, but it just like wants to come to me.
Mhm.
And I really don't mind petting the dog. However, if I can't immediately wash my hands, oh honey, that dog cannot get pet. It just can't. I need to be able to control that, right? Because then I think, well, I might touch my mouth or scratch my face. And where's the dog been? Did it use the restroom before? So there are all these OCD like thoughts that come up.
Yeah.
So the best way I handle that is to just talk to the dog and not touch it. I can let my kids pet the dog though. And then I say, okay, when we get home, when we finish our walk, we're washing hands.
That's important.
There's a workaround.
Yeah, yeah, absolutely. Okay, so you said CBT and mindfulness. What if somebody is just absolutely not even able to grasp like the CBT concepts, right? Or they're like, oh, I already know this, but I can't do you think I'm like dumb? That's a lot of what people will say, right? Because like it
Yeah.
seems so obvious, but
Hmm.
how do you like reframe that for them that it's not necessarily that you don't know it, it's a practice. Like how do you deal with that? Because I mean, I
Yeah.
normally for me, OCD patients, a lot of the times I will send them to somebody else for CBT because I feel
Hmm.
like they're CBT experts and even though I'm trained in it and I know it, but I'm just like, I'm gonna send you to the CBT person. So,
Yeah, yeah. That's a great question. I normalize it for them. And when I'm working with people and OCD does come up, I'm transparent that I'm going to be your OCD cheerleader because I actually got the diagnosis at 19. I don't make it about me, but I think it's that piece that normalizes it for them. They're like, "Oh, you might have had similar thoughts to me." And I'm like, "Trust me. I've been on the medication. I've been on the things. I'm going to be sharing with you what worked for me. That's what we're going to be working through. If at any point it doesn't work, then we'll adjust us the treatment plan." However, I think one thing that's been helpful for my clients is when we talk about CBT, and I don't do the newer forms of CBT. I practice traditional CBT.
okay, yeah.
I say some of the worksheets I send you are going to say your thoughts are irrational. I
Mhm.
want you to just replace that with it's rational. So going back to the example of my childhood home being broken into, and I get visualizations as I talk about this. I would after college, this is still after college, right? I'm still dealing with OCD. I'm in my one bedroom apartment. I'm checking the door multiple times, right? So I may have a client in front of me that says I check my door like 17 times a night and it's exhausting. And I'm thinking, I get it. Right. I don't make it about me, but I get it. It is exhausting because you're falling asleep and you keep getting up to check the door. Have you ever had your home broken into? Right. Have you ever had someone in your home who wouldn't leave? Have you ever had someone maybe you were dating and you gave them a key and they wouldn't give that key back after you broke up? Or you feared them coming in after an argument because they had an anger management issue? I try to look for where are other areas in your life where safety has been a concern because that's how we get to normalize it. And for me, that was especially important to
Yeah.
connect that dot. This may be the diagnosis. This may be an OCD like behavior.
Mhm.
However, you also have in your young and impressionable this home invasion where your
Yeah.
safety was jeopardized, your
Mhm.
privacy was jeopardized, right? In our home, whomever came in, they emptied drawers. I mean, we came home and stuff was just everywhere. They were looking for money. They stole jewelry. I mean, that's as a kid, we're scared. And now
Mhm.
you're telling me I'm safe at night. So the first part is looking for other areas where that could be impacting that behavior subconsciously. And then that other piece is saying, we're going to do some CBT. If you
Mhm.
consent, of course, if that's not your
Mhm.
preferred method, we'll look for other methods.
Mhm.
However, we don't have to say that thought is irrational because the thought that someone might break in and
Yeah.
you need to check that door, that's rational. Even if you haven't had a personal experience where someone's broken in or those other examples, just watch the news at all of the home invasions. If you're
Exactly. I agree.
consuming
Yeah.
any of that, it's scary. So that's how I go about it. And so far, no one has pushed, well, several people have pushed back on using CBT because they used it previously with psychotherapists who did teach it in a way where they said their thoughts were irrational. And
Agree.
so there's a lot of resistance you get when you tell someone, an adult especially, well, these thoughts are irrational. But
Mhm.
we're going to work to categorize them because some of these thoughts may be irrational. Some of them may be. We're gonna figure it out together which ones they are. And some are likely very rational because of other life experiences. So that's how I would approach it.
Yeah, that's incredible. Almost like a psychodynamic kind of figuring out what, where exactly what
Hmm.
happened. So that's really good. I'm really glad that, that's what my approach is most of the time. But however, with that being said, the whole numbers and 4 and 8 thing when you're reading, I'm really curious.
Go
Must have
for
been
it.
really tough. Like,
Hmm.
so what was exactly like going on, just so that people can know, like that is
Yeah,
like OCD. So what
that's
was going
OCD.
on?
Yeah. So, and even to share what's going on, which I'm so happy to share. I'm so happy you asked because I want to educate people on this. When I think about OCD, I think about my younger self often. So I know we're talking about that college experience. My brain always goes back to the little Kita that
Hmm.
experienced this and no one knew. The numbers, I can't remember. Again, it was around age 7, but I had to land on an 8. And if it wasn't an 8, I needed to multiply that 8 by 2. And it's not, I fully understand if anyone's listening and they're like, this makes no sense. This is
Hmm.
irrational, right? This is where, when we're looking with people to do an inventory of their OCD behaviors and thoughts, this is one I would very much categorize as irrational. It was very irrational for me to have this obsession with number 8. 8 is my favorite number, by the way. So that's likely why my brain latched on to, oh, everything has to be in pairs of 8s. You can imagine that I was very good with multiplication because but my brain as a kid would say, count to 8. And I would count
Yeah.
to 8 in my head. No one knows this is going on, right? So I can get away with it. And then it would kind of say, that's not enough. That would be the thought. That's not enough. Count up another 8. So then I'd be at 16. Next thing you know, I'm whatever 8 is times 10 times 20 because I'm just in my head counting. And so what I have found out is that when my stress is very high, there was some trauma in my childhood. So when my stress is very high, my brain would default to numbers as a way to distract me. And of course, it was a symptom of OCD. I didn't know that at the time. However, it shows up differently in different stages of life.
Yeah.
So it really does. And even now, I'll think, you just took a sip of water and you were satisfied with that. Why do you want another sip? Right. So sometimes I'm like, is there stress? Do you really want a sip of water? It's so simple. But this is the OCD brain. That's why it's good that we're talking about these things. So in college, I would read, and sometimes it would be that what my brain would say, you need to read that 8 times.
Oh goodness. Okay.
And, and sometimes it would be, I've read it and I didn't absorb it. So then I read it again. And then next thing you know, I've read it about 3 or 4 times. And then I kind of pop into awareness and I'm looking at everyone else at the table and, we're drinking coffee and we're trying to make it through the night because we're pulling an all-nighter.
Yeah. Yeah.
And then I'm just sitting back thinking, what's going on with me? What's going on with my brain because I'm not capturing any of this information. So, of course, I didn't pass the test, right? Of course, I didn't do well. So, and it was very challenging to me. It challenged my identity big time, having that OCD exacerbate in college. Because in high school, I was on the top 10. I was number 7. So if you think you are number 7 in high school out of around 200 kids, and you go to college and you're having isolation, homesickness, you're depressed, your anxiety and OCD is increasing, right? Everything's going up. And then you're not making the grades. Oh, now we have an identity attack because who am I? I'm not as smart as I thought I was. so, so yeah, it was, and you feel free to ask any deeper questions around that. That's the best way I could describe it. But it was just 8 was my favorite number, and I think my brain latched onto that and said, "Let's do
Yeah.
this in pairs." It would. That was the obsession was the number,
Yeah.
obsessing about numbers, and the compulsion was to count. I have to keep
Right.
counting,
Yeah.
and that decreased my anxiety because I'm satisfying my brain's need to count up in multiples of 8. So that's probably I probably should have started with that. That's a better way to explain it.
So the reason I asked was because I want to make sure that people don't confuse it with like, dyscalculia, whatever, just numbers
Mm,
issue versus OCD, because this is
hmm.
specifically you counting words up to like 8. That have I read 8 words? That's where the
Yes,
sentence needs to stop. Were you
it's
doing
a
that with
lot.
writing too, where your sentence had to be 8 words or?
No, no. Yeah, it did happen with writing. It didn't
Yeah,
happen with
that's
writing.
good. Yeah,
As a
but this is very
kid,
difficult.
it is, yeah. As a kid, it was touch. So even if I accidentally, and right now I'll just touch my laptop, but if I accidentally touch something, my brain would say you need to touch that another 7 times to equal 8. Why did I need a math tutor at one point? I don't know because I should have
Yeah.
been like a superior mathematician. But yeah, so I would find ways to touch it up to 8 times. And no one
Yeah.
noticed because I was very crafty, even as a kid. And like I'd go to the kitchen, come back, touch it again. Oh, that was 2. I accidentally bumped it. That's 3. I remember doing that as a kid. So yeah,
Yeah.
obsession with the number 8.
Yep. Looks like it. Okay, so CBT. Next thing I want to ask about is self-care. What are you doing for self-care practices? Because
Yeah.
that's another thing that's very important. I feel like a lot of, mental health providers are telling people to do things and not doing it themselves. So
Mm-hmm.
what
Mm-hmm.
do you do for self-care?
Yeah, yeah. So the mental so there's mental and there's physical.
Uh-huh.
So the mental things I do for self-care, It is practicing my skills, my CBT, my mindfulness-based skills throughout the day, challenging negative thoughts, putting thoughts on trial for anyone who's listening. That is an actual CBT strategy. So
Mhm.
I do that throughout the day. I also pause as often as I can to just have a moment of silence, and that's my meditation. I don't do it as frequently as I should. I also like guided meditation. I also don't do that as frequently as I should. You know, life is busy, but there are times where I lean on it more than others. And part of that is giving myself the freedom to not get obsessed with any particular strategy because that will trigger some OCD if I get
Mhm.
obsessed with it. So I just say, whatever you need to do today is what you need to do today to care for yourself. I do some journaling. Again, that's at a minimum. I journal about once a month in my digital journal.
Yeah.
And then more so physically, it's stretching. So, especially if I'm going to do an accelerated resolution therapy session, my
Mhm.
strategy is I schedule those on Thursdays, and that's a trauma-based treatment, just for anyone who's listening. And I will do a bar class at 8:30 in the morning, and then afterwards I might have my latte, and then I come home and I've been get ready, do my face, all of that. I have my yoga mat out. I'll do some stretching to kind of release any tension that's in my body because it's an eye movement therapy. So I know I'm going to be moving my hands, you know. And then I pray for that person and I pray for myself. Prayer is a huge part that's actually on the mental
Mhm.
side of what I do to manage my self care. And I pray for my clients as well that they get the release they deserve from whatever they're suffering with. And I take walks for self care this week or this past week, because now we're in a new week. I had 2 massages. And some people will say, oh, well, you must have it like that. The money must be flowing in, right? And it doesn't have to be about the money. I go to a massage school where they had a special of $10 massages
Mhm.
this
There you
last
go.
Wednesday and Friday. So I paid $20 for massages at a massage school, and they were quality massages, right?
Yeah, absolutely.
So, yeah. So I do that. I don't do HIIT workouts anymore, but it's more so strength training,
Uh-huh.
strength-based training. I haven't done it in over a month, the strength-based training, because of some health stuff, but I'm getting back into that. I regularly see my medical professionals. I see my
Mhm.
therapist once a month. That also goes on the mental side. I
Sure.
practice boundaries. I don't just tell people my boundaries, I enforce them. I
Mhm.
don't answer the phone when I know I don't have the capacity to talk or hear what people might be going through, especially if I have an idea of it. I try to get out and meet with other practitioners. You know, I did
Mhm.
that on Friday and had breakfast with a lovely practitioner that I just happened to meet at Dr. Mullick's networking event the week before. So, what a wonderful way to connect. I
Mhm.
attended your networking and how are you really event, and that was life-giving for me professionally and personally. So I kind of look at how can these things intersect?
Yeah.
Because yes, I'm a psychotherapist and I'm also Marquita the person, and those often overlap. So even if I'm hanging out with other people in the mental health field, well, that needs to give to me too. And I want to give and receive in those interactions. So I can keep going, but now I'm like, wait a minute, you really did do all of that. So anytime you
Yeah.
question your own self care, that you are doing it.
Absolutely, absolutely. I was gonna say that like the should thing, right? I should be doing more of this or I should be doing more of that. That is not necessarily true. Your body kind of tells you what you need,
Tells
and
you.
that's where, it goes. But also like I know you separated the physical and the mental, but I know that you and I have talked about the mind-body connection and how much
Hmm.
like that physical care also like
Yes.
affects your mental. So
Yes.
stretching, you
Yes.
said that you release like trauma when you stretch, and
I
that's
do.
which it is so on point because that's how I
Yeah.
feel from stretching too. I feel like all that stress that I carry,
Hmm.
stretching is what releases it. So yeah,
I
I think that this is
agree.
amazing. I'm so glad that you're
Thank
doing all of
you.
this to take care of
Thank
yourself.
you. Guess I'm doing better than I thought. Yeah.
Yeah, there you go.
And
Sometimes
you know
you
what?
just have to talk about it to remember.
You do, yeah. And I hadn't even what I tell people online when I'm doing my videos is that my anxiety pill is exercise. So I don't even know why I separated that one because when I
Yeah,
exercise, the first thing it's for is to manage anxiety. And the second
exactly.
thing, the physical, the toning and all of that, it's secondary to
Yeah.
if I don't exercise, that
Yeah.
anxiety could creep up. So yeah, you're right. There's such a mind-body connection.
Right, absolutely. I always say that like any like mindful eating or exercising and fitness, it's not necessarily to lose weight, it's to
Hmm.
take care of your body and in turn your mind, right? Like it's all
Mm-hmm.
connected. And
Yep.
so, yeah, so I think that those are beautiful things that you do. One more question about like, and it kind of falls in the
Yeah.
treatment realm is support systems, right?
Mm-hmm.
What is your support system like? I know you talked about other, meeting with other providers and other therapists.
Mm-hmm.
What about like at home friends? Like, what
Mm-hmm.
is that like? And how can that help when somebody has
Yeah.
OCD and anxiety?
Yeah, I think it's so important to stay connected to people because OCD is very much in the brain, and there may be these physical actions we take when we're acting out the compulsions. However, the more we get out of that mental space and connect with other people, it can normalize or denormalize some of our behaviors, right? As we see other people interacting. And I think
Yeah.
it's helpful to see the difference between the two, like, oh, well, she's not touching her fork 8 times. Okay, maybe no one else is doing it except for me,
Yeah.
I think it can help. Um, so yeah, I have support with other professionals. My husband is very supportive. In the beginning of our marriage, he wasn't so sure that these things were actually true. These, like he wasn't sold on this idea that
Okay.
really there are these mental health diagnoses and these are all of the symptoms. Like it took us moving right after marriage. We were married for 6 months and then we moved to Massachusetts. And I think my medication was in transit. I forgot to pack it. And boy, did he see, like the cleaning.
Yeah.
Oh, gotta clean all day. So he is one of my biggest supporters. I come from a family who historically did not believe mental health was a thing, especially in the Black community. I think we're doing a lot better with the stigma. However,
Yeah.
back then, I went to college in 2001. So back
Mhm.
then, it was no, we don't do that. We don't do therapy. You don't need to take medication for that. I don't know what they're telling you, trying to diagnose you with stuff, right? My mom has become one of the biggest advocates of mental health in my hometown in Louisiana, and I'm so proud of that. My husband is very supportive. We have very open conversations about mental health in our home, so our kids know what several diagnoses entail. But yeah, and then I have two friends who are in different states, but we connect either daily. I communicate with one on an app where we communicate daily, and another one we communicate at least via phone, maybe like once every 2 weeks, and then we text in between. So, and she's always like, "How are you mentally?" She actually texted me that this past
Oh,
week.
that's
How
so
are you
amazing.
doing mentally?
That's so amazing.
Yes, so I have a lot of support, I would say.
Yeah, yeah. I have a friend who will say, "How are you, Faru?" And that, like, she calls me Faru. So she's the only one
Yeah.
that does that. But like when she says that, I know she's asking me, "How are you really?"
Yes, yeah. How you really doing?
Yeah. So I mean, I'm so grateful to have friends like that, right?
Yes.
And this is going to be a topic of conversation, and we'll have like an episode or two just dedicated to the history of psychiatry and mental health in Black America. But I
Hmm.
think that's such an important topic, so I appreciate you bringing it into the space and just the stigma that is
Yeah.
involved with that and the history of stigma, why there's a stigma, right?
Yeah.
Why is the Black community afraid of like being diagnosed or labeled with any mental health illness? And I think that will be a completely different podcast that we should
Yeah,
definitely maybe one or two episodes covering that because it's such an important topic.
definitely. Yeah, it deserves some time and attention. Because again, there's improvement and we can always do better.
Yeah, absolutely.
With all communities, we can always do better.
Exactly. And knowledge, right? Knowledge is power, knowing
Hmm.
that this is what happened. That's where the stigma came from. And so
Hmm.
can we let it go? Because that's
Yes.
not always going to be happening, right? So
Yep.
just kind
Yep.
of letting it go so that people will seek help like yourself.
Yes.
Amazing.
She's amazing. She
Yeah.
is.
Right. So, last thing is anyone that is struggling with anxiety and OCD and feels like their own sparkle has been lost, what is
Hmm.
one piece of, key piece of advice or encouragement you would offer them on their journey towards?
Yeah, yeah. Oh, it's hard. How do I break it down into one key piece? Can I give two? Oh my gosh, so limiting. No. Well, I always tell people to take inventory,
Mhm,
because a lot of times we're going through things and we lose the
mhm.
sparkle, but it's so, and because I know you're a psychiatrist who also does psychotherapy. It's so much behind that loss of sparkle, and people just think, I don't know, I just lost my sparkle. It's like, tell me what's happened in the last 2 years in
Yeah.
your life. What about yesterday? What about last week? And so really taking inventory of what's going on in your life that could be categorized as a stressor. What's
Mhm.
bothering you? What are you not acknowledging that could be bothering you, maybe some things you've suppressed. Maybe there are some subconscious things from your past that you repress for a reason, because our body's going to do that to protect us. And go you, go body, it did it. And now we got to work on it so you can release it and heal. So really taking inventory. And then the bigger piece of advice is it is okay for you to do a consultation with psychotherapists and medication prescribers to just see. I think oftentimes people think, well, if I do that consultation, I'm signed up. Like I'm in it to I gotta move forward. And you don't have to. It's just you assessing whether or not that person is a good fit, whether or
Hmm.
not their services really could help you. So I
Hmm.
would say the biggest takeaway or piece of advice rather is if you feel that something's wrong, if your sparkle has been lost, please seek a consultation with someone just to see. Because sometimes people are like, I'm so afraid of the consultation. And then I've had this happen over and over throughout the years, right? And then they talk to me and they're like, this isn't as bad as I thought. You ask me questions that I hadn't thought about, or it feels good to talk about this. It feels good to let it out and not just have it in my head, which was the release for me, even just in therapy. Like I'm not just dealing with this on my own now. Like someone else is hearing this, it's out. So those consultations are often some of the biggest motivators for people to connect with the provider and make a decision on whether or not that person can help them move forward. So yeah, seek consultation and take inventory of the things that are impacting the sparkle, dimming that light, because you deserve to have that light lit. You deserve a life that sparkles where you have joy and beauty in it, and you get to define what your superpowers are.
Yeah. All right. That was beautiful advice. So I want to ask, you are always smiling. You're such a beautiful, happy presence.
Thank
How
you.
are you really doing?
How am I really doing? I'm doing really good.
Yeah.
Yeah, yeah, I'm doing really good. I mentioned some health stuff over the past month. I had
Mhm.
the flu a month ago, and that really threw me for a loop. And
Mhm.
even through that, I thought you can let this challenge all of the work you've done historically to be this happy person, or you can just say, this is the flu, it will pass. Still, how can you find joy even though you have the flu? So I was like, well, there's a lot of downtime. Well, my husband's picking up the kids now. I'm relaxing. I can watch Love is Blind.
There you go. There you go. I binge watched that show. It's like- I'm like, I need to know. I need to know.
I need to know who gets together, who gets married. So yeah, I'm really in a good place. And part of, a lot of people say that you're always smiling, you always seem happy. It's because I do the work. It's because I commit to daily saying, what are the things that are going to bring me joy internally? What thoughts belong here? What thoughts don't? If these thoughts were my friends, would I hang out with them? Would I really want to go to ladies' night with them? And we have a lot of negative thoughts in the day. So you can't come hang out with me at the Oxford Exchange. Oh no, ma'am. So those thoughts have to go. So yeah, I'm really doing good. Really doing
Yeah,
good.
I'm
Yeah.
so glad. And I'm so thankful for your presence. You're just beautiful inside
Oh,
out.
thank you.
You bring light into a room when you walk in. So I appreciate you being in this space
Thank
with me
you.
today.
Yes, I appreciate you inviting me to be in this space.
All right. Well, thank you so much. I will let you go. And thank you to our viewers for watching our episode and stay tuned for the next one.
Absolutely.
Bye.
Bye.